Atropine. Atropine is the most famous muscarinic antagonist. It was originally found in the plant leaves of Atropa belladonna, aka deadly nightshade. And just to throw in a fun fact, belladonna in Italian means beautiful woman. The plant got this name because it was used in eye drops by women to dilate the pupils of their eyes to make themselves beautiful. Now, the classic phrase may be helpful to remember the adverse side effects of atropine. Hot as a hare, dry as a bone, red as a beet, blind as a bat, mad as a hatter, and as full as a flask. If you have trouble remembering this phrase, you can also work your way through the logic of a muscarinic antagonist. Remember, a muscarinic antagonist inhibits parasympathetic outflow and blocks the activity of muscarinic acetylcholine receptors. It does not block excitation of skeletal muscle, which have nicotinic receptors. So let's tackle each one of these statements. Hot as a hare and red as a beet. Do you remember what receptors are found on sweat glands? That's right, M3 receptors. Therefore, blocking these receptors will decrease sweating, making it harder for your body to cool off. As your temperature rises, your body tries to release heat by vasodilation, causing your skin to flush. Dry as a bone. Again, blocking M3 receptors prevents secretions from bronchioles, the stomach, salivary, lacrimal, and sweat glands, leaving you with no secretions, aka dry as a bone. Blind as a bat. Remember, blocking M3 receptors of the pupillary sphincter and ciliary muscles of the eye will cause mydriasis, aka pupil dilation, and loss of accommodation known as cycloplegia. Mad as a hatter. Obviously, we are speaking about the CNS here. And what types of receptors will we find in the CNS? That's right, M1 receptors. Antagonism of M1 muscarinic receptors in the CNS can make you confused and agitated. Just think about the last time you took one too many Benadryl and how it made you feel. Full as a flask. Following the same pattern, antagonism of M3 receptors in the detrusor of the bladder will leave you unable to urinate. Now, the likelihood of having a question where a person overdoses on atropine is fairly low, but you might get something like this. There is a famous clinical case about a patient that presented to the emergency room with right-sided mydriasis. The medical team was concerned about damage to the parasympathetic fibers that control the pupillary sphincter muscle. But the man was healthy as a horse, with no pain nor any medical history. A medical student actually got the information that the man worked 6 days a week in the botanical gardens. It turns out he was not wearing gloves when he was cutting the leaves of the datura, commonly known as Jimson weed plant. This plant is from the nightshade family. So he then rubbed his right eye, and his coworker noticed that his left pupil was smaller than his right. What happened here? Well, he directly inoculated himself with the anticholinergic secretions of the plant, causing right pupillary sphincter paralysis, which resulted in a large right pupil. Can you think of a group of drugs that could be used in the treatment of anticholinergic toxicity? Well, we would want an anticholinesterase, which indirectly increases acetylcholine, which can knock out a muscarinic antagonist. And to combat the mad as a hatter effects, do you remember which anticholinesterase can freely cross the blood-brain barrier, the BBB, and enter the CNS? Physostigmine.